there, Dr. Corrado. Thank you so much for taking the time to join us today. We are so excited to share your work and also your recent publication. So, you recently published a paper titled Anakinra Improves Retention Rate of Targeted Treatment in Erdheim Chester Disease. And the aim of this study was to assess drug retention of targeted therapies in ECD patients from two Italian referral centers and to investigate the influence of a combined Ankira plus targeted therapy approach. Can you provide us or share with us your professional background and how you got involved in this study and also like the treatment of histocytosis?
Thank you very much, first of all, for this invitation. I really love the fact that you invited me to talk about our work, and I really love to have the patient support organization of patients with us. That's really crucial for us to go and to step forward in the research in the field of histiocytosis. They are extremely rare diseases. My background, I'm a clinical immunologist and rheumatologist. I'm based in Milan, in Italy, and I got interested in histiocytosis and particularly into Erdheim Chester disease thanks to my mentor, Professor Lorenzo Dagna, who's the chief of the department, who's always had a great interest in Erdheim Chester disease. So that's why I first learned with him how to deal with patients with Erdheim Chester disease. And over the years, we got a really huge cohort of patients. So we're one of the referral centers in Italy for Erdheim Chester disease. And we appreciate the fact that the patient have been really supportive also for the research, and they always want to be informed about what are the breakthroughs that we have gone through over the years. And in this study, we managed to do this study with like my center, so in Milan, together with the center in Florence with Professor Augusto Vaglio, who was the other referral center in Italy. So we have the two major referral centers. So we combine our cohort to patients. And this study came after initial observation that once we started using the targeted treatments for patients with Erdheim Chester disease, we found that also some patients at the beginning might had a bit of inflammation soon after the start of these treatments or even before starting these treatments. So we thought of using Anakinra. That's something that's also already included in the recommendations, the guidelines for treating patients with Erdheim Chester disease. And so we managed to start the first few patients on a combined treatment, so the targeted treatment together with Anakinra. And we found that these patients could actually benefit from this combination and also could have like fewer side effects of the targeted treatment. So after this first observation that we mentioned years ago, we decided to actually start basically most of the new patients on this combined treatment. So we know that Erdheim Chester disease is a complex disease. We know there are some mutations, and we have, like over the years, we managed to have some drugs for these mutations. So we know that we can combine especially bemrafenib or cobimetinib, which are the major targeted treatments that we use for Erdheim Chester. But since we started using these targeted treatments, we found that some patients could have some side effects. And this would prevent us from keeping the patients on the treatment, of course, because the patient will experience some even really nasty side effects, especially the skin reactions with these drugs. It can be really important. And then we observed that with the use of Anakinra, we could prevent some of these side effects. And so we combined our experience with the other center in Florence, and we therefore analyzed the patients who were started on targeted treatments. And we saw that a quarter of the cohort, when we combined our cohort in Milan and the cohort in Florence, a quarter of patients were started on the combination therapy since the beginning. And what we observed in our study was that the retention, the drug, meaning the amount that the patients could be on the drug, was longer for patients that were started on the combined treatment with Anakinra compared to those that were started only on the targeted treatments. And then we also said that this was due to the fact that we had fewer patients and had to suspend the drug due to toxicity. The crucial point that we observed is that the combination of the two drugs could allow us to use the targeted treatment for a longer period of time with fewer toxicities. And that's really important for the patients because we know that Erdheim Chester disease, like other histiocytosis, are chronic diseases. So we need not to think just for how to treat the patient now, but we need to think on how to treat the patient on the medium and long term because we know that unfortunately disease are chronic. So we need to find a strategy for making the patient be on the treatment for the longest period of time and with the fewest side effects we can think of, especially because we know that the compliance and the side effects are crucial for having this strategy in the long term. And then so in our study that is retrospective, so of course the level of evidence is not as strong as the randomized controlled prospective trials where you can actually assess that is really useful. But in this retrospective study, we found that there was this advantage in combining these drugs. So definitely this paves the way for thinking about the combination therapy in Manchester and maybe even in other histiocytosis where the same drugs are used. But our study was just focused on Erdheim disease, so of course we can just have a bit of evidence for this specific condition. And we can think maybe of having prospective studies like through like with a greater level of evidence to confirm our findings and to see whether actually the combination therapy with a targeted treatment combined with Anakinra, which is an anti-inflammatory drug, so the two things together could help us to treat the patient for a longer period of time and to have fewer side effects and better outcomes in regards to the histiocytosis.
With that, what were some of the key findings that you guys found from this study?
So the key findings is that actually the combination is good, that the patient do not have side effects from anakinra, that we know that some patients can experience side effects from anakinra, and actually in our study we found that patients with Erdheim disease did not suffer from any side effects from the injection of the anakinra, and we found that they could be on a longer period of time with the same drug. So the drug retention rate with the targeted treatment was longer compared to patients who were only started on the target treatment alone compared to the combination.
That's pretty interesting. From what you know, can you share more about where you see your research or the histocytosis research will be in a couple years?
I think that this strategy of combining treatments together is a good way to go in the future for the research in histiocytosis. We know that has already happened in other diseases in the past where we were using a single drug and then we thought that maybe a combination drug would be better for the patient, for the outcome. So I think that definitely the use of a combination strategy upfront, meaning since the very beginning of the disease, could actually be really useful in the long term of patients. And I think this is something we need to pursue in the future so we can think of future studies with a good level of evidence, such as the randomized controlled trials, where we can actually confirm that the fact of using two drugs together can be more helpful than using the single drug since the beginning. And I think in the end, another thing that's really important in the future for histiocytosis is to combine the disease, because we know that especially in head-and-chest disease, this disease has two major phases. One is the proliferation of the mutated cells, and the other one is the inflammation. So I think that fighting both sides of the disease, so both the inflammation on one side and fighting the proliferation of cells with the mutation, is important. So we can think about like future strategies that can address the both sides of the disease at the same time, so we can target both.
Really good. And you had mentioned before, like, it's important to help the patient now, but also find strategies for future and long term. Is there anything else that you would like to share with the community?
First of all, I would really thank all my patients. My patients and the families have been like extremely supportive over these years. So they've always been really supportive about like sharing the data and improving the research in Eden-Chester and even with donations for the research. So I think that really the Eden-Chester community, especially which is the histiocytosis community I know most because of course I'm dealing with Eden-Chester diseases patients first. They're really amazing, and it's thanks to them that we can do this kind of studies. We can step forward in the research in the field of histiocytosis.
Well, thank you so much. We appreciate you for taking the time today to just share more about the study and for meeting with us today. Thank you.
Thank you very much.